Let's look at some breathing patterns. So, just to quickly recap, your diaphragm contracts down, creating negative pressure to help these lungs fill with air. This also creates some intra abdominal pressure. So, let's give this a try. What I want you to do is I want you to take your hands and place them around your waist, just under your ribs. Now, take a big inhale. Do you feel the pressure expand into your hands? If you don't, you're probably a very shallow breather. So let's try this again. And this time, do the inhale into your hands. Really concentrate on it. Do you feel the pressure that's generated when you do that? That comes out into your hands and down into your pelvic floor. Now, I want you to do this a third time. And this time, after the big inhale, I want you to exhale really hard. Do you feel the pressure that's generated when you exhale really hard? So, doing that, you can start seeing how this breathing system creates pressure to help our spine. So, as the demand increases, so does our breath. So, let's take a think about this. If you're going to be lifting something really heavy, like the couch or helping somebody lift something up, you're probably going to exhale hard because it's going to be a lot of effort. And when that happens, you're going to be creating a lot of natural spinal stability through your breathing system. But what happens when we do something higher than our trained capability? So think about lifting a really heavy weight at the gym. So you're seeing those people who are doing the really heavy bicep curls or chest presses or shoulder presses. Or you're at the park and your 60-pound toddler wants you to lift them over your head so that they can reach that bar to swing on. People normally hold their breath when they do something that is over their trained capability. And by doing this, you mess with the natural inhale, exhale pressure system. This system is a fluid system that is constantly adjusting to keep your spine, pelvis, and core safe. So when you hold your breath instead, you tend to brace. And that means that you're often bearing down onto your pelvic floor. So let's have a look at a few factors that can decrease your diaphragm expansion. So having a flared rib cage can do this. Now, a flared rib cage can be a really wide angled ribs or flared forward and out. Poor core firing can also decrease the diaphragm expansion. It's not always about the strength of your core, it's about the coordination of all the ab muscles with the diaphragm and your pelvic floor. A tight or tense pelvic floor can stop the full expansion happening. Holding in your belly button, remember that balloon picture where you squeeze the balloon around the middle and you see the diaphragm and the pelvic floor bulging? Poor posture, so hunching forward or having that anterior pelvic tilt, and also being in a shallow breathing pattern can cause this decrease of diaphragm expansion. So now let's have a think about what a good breathing pattern is. So in a good breathing pattern, you should get this 360-degree expansion. Your ribs should go forward, to the side, and to the back. Your ribs attach both to your sternum and they also connect around to your spine. So when we're breathing or thinking about breathing, we often just think about the sternum connection because we're thinking about our chest moving. But the costovertebral joints where the ribs connect to the spine should move as well. So when you are inhaling, what's going to happen is your ribs should move forward out and up in this lateral movement. And a lot of people, well, sometimes you'll hear them saying it's like lifting a bucket handle because you're getting this lateral movement up, just like you would with a bucket handle. A shallow breather, however, won't get this movement. They will just shift their whole rib cage up and down, their shoulders along with it. So much more like this pump handle here, where your rib cage is going up and down, and your shoulders are getting tenser and tenser as the day goes on. So what are the main breathing patterns that I see? And we're going to go through some videos in the next video I do, watching some of these breathing patterns so you can see exactly what they look like, and then you can go and video yourself or watch yourself in a mirror and check what your breathing pattern is naturally. So belly breathing is a big one, and that's just where there's just the expansion out the front. So your belly is literally going out and in. The shallow breathing pattern that we just talked about with the pump handle, a really good 360-degree expansion breath where your ribs are going out to the side, to the back, to the front, as well as your belly filling out. And then I also often see a mixed breathing pattern, one of which is when you're actually pulling or sucking up your diaphragm upwards when it's meant to be expanding downwards. So we're going to go through all of those in the next video. If you have any questions of what I've said today, please post your comments below, and I look forward to chatting to you.